Hello, everyone. Thanks for joining me today. I'm Dr. Mary Rondeau. I'm owner of Wholeness Center in Fort Collins, Colorado, which is a large integrative mental health center where we work with a variety of modalities, including botanical medicine. And so today I'm going to be really taking a deep dive into CBD and mental health to help give you some clinical guidance on how to use this tool, when it's appropriate, when it's not, and some of the limitations as well. Here's some current controversies regarding CBD and cannabis in general, looking at what are the herbal synergies of cannabinoids, the pharmacokinetics, and really understanding dosing strategies and ratios between CBD and THC ratios, especially in specific populations, ones that may be more at risk for severe side effects like psychosis, the cyclooxygenase inhibition, and really diving into the inflammatory component. So again, CB1 is primarily found in the brain, in the central nervous system, and much lesser extent in the other tissues, where CB2 is going to be most concentrated in the peripheral organs, and there's a greater association with the immune system. And you can see the parts of the brain that are targeted. So specifically with CB1 receptors affecting the hippocampus and how that correlates directly with memory and learning. We've got the amygdala, which is responsible for emotion and appetites, the basal ganglia and motor function, cerebellum, coordination, attention, and time sense. The nucleus accumbens, it has the reward mechanism. This plays a role with addiction. We look at the literature and what has been published over a period of time. We see that there was some papers published in the 70s, pretty low amount. Then in 2000, we started to see a really abrupt increase of papers that were publishing on cannabidiols in neuropsychiatric conditions. So as of 2016, the steam was picking up really quickly, right? There's a lot more papers being published. But this also means that we're still learning a whole lot about how CBD affects different systems and how this may translate into the treatment of certain conditions. So in our case study, we had 136 patients. They were treated with CBD for anxiety or sleep disorders. This was over 9 months. We saw 27 pediatric patients, 59, we had 3 months or more of data for them. We used rating scales like the HAM-A or the Pittsburgh Sleep Index. We also used different scales for kids to determine how they were doing. The dosing ranged quite large, anywhere from 3 milligrams up to 175 milligrams. We did 3 milligram sprays, particularly for kids who couldn't swallow capsules, and we did 25 milligram capsule dosing at a time. The most common dose that we used was 1 25 milligram capsule per day. It was very well tolerated. The main side effects noted, which only happened in 3 patients, was dry eyes and some fatigue. We did have an adverse reaction in a developmentally disabled adult that with the use of CBD, he became absolutely fixated on sex and sexual intercourse, likely because it just decreases inhibitions.